And at this time, I would like to call the Human Services meeting to order. Need to start with an approval for our agenda.
So moved.
Support.
It's been moved and supported. All in favor say aye.
Aye.
All opposed the same. Thank you very much. Next item on the agenda is public comment. We have any public comment at this time? Any public comment at this time? All right. Doesn't seem we have any public comment. That takes us to our first item. Our first item on the agenda would be for us to approve the minutes from our May 11th Human Services meeting.
So moved.
Support.
It's been moved and supported. Any questions, comments, concerns? Seeing or hearing none, all in favor say aye.
Aye.
All opposed the same. All right, and our minutes have been passed. Next item is our appointments for this month. We've got several positions still open on the Sanitary Corps Board of Appeals. We do have one application for well driller Maine. Charles Sebastian III has applied, and we would now entertain a motion for him to be moved to the full board unless there's any other recommendations to go along with it.
Nomination of Charles Sebastian III.
Support.
All right, it's been moved and supported. All in favor say aye.
Aye.
All opposed the same. All right, thank you very much, Mr. Sebastian, for applying, and we will get that approved at the next meeting. And up next is Lifeways.
Good afternoon, Commissioners. So in your packet, you will see your report for the month of June. I will, like many organizations, the report has a lot to do with the current pandemic and the impact that that's had on Lifeways over the course of the last, 12, 13 weeks now. So I do want to kind of highlight some of the things in the report that references the impact and what we're doing as an organization now and in the future to address the issue. On that first page there, you'll see that when the COVID situation occurred, one of the things that we saw initially were crisis services went down. I think people were afraid to go out and to seek care. The average about the first month of the COVID situation was about 22 to 25 crises a day, and now we're back up to 50 or greater. So people are starting to re-engage with services, and that's a good thing when we talk about mental health. We are in the process of phasing back to work. We implemented a 4-tier plan. The plan included a review of the CDC guidelines, recommendations from the department, as well as seeking feedback from our local county health department relative to our plan. The plan includes training. It includes an evaluation of every employee and the level of PPE needs based on their level of risk. And so we have put that into play. We have moved from a Tier 4 to a Tier 3. Tier 3 allows us to have more face-to-face contact with individuals, and it also allows for those who can do administrative work still off-site to do that. We will, based on the numbers of our plan is the prevalence of the cases locally will, as we continue to see a decrease, which we are locally, both in Jackson and Hillsdale County, and we are a 2-county organization, that we anticipate that by Monday of this next week we'll be moving to Tier 2. And then eventually back to Tier 1, which is our normal state. So do know that we are providing crisis services on site, and if individuals are in need of mental health services, do let them know that we are providing those and increasing their face-to-face contact. We also had, during the course of this COVID, our recipient rights assessment audit, and we did have a couple areas that were concerning, and we scored a 392 out of 462. and we're in less than substantial compliance, so it does require a plan of correction to the department within 30 days. There were two major areas that contributed to the area relative to our scoring, and one was around our appeals, and some confusion with both the individuals that were being interviewed about the appeals process for recipient rights, as well as the auditors. And I will be submitting a response to the department, because I do believe that was not scored correctly. But I will be sending a response to that to the department. But anyhow, we will be submitting a plan of correction, but did want to let you know that had occurred. There were many areas which they noted significant improvements and strengths of the organization from the last audit. Lots of improvement from that department relative to timeliness of completion of investigations had significantly improved, as well as the quality of the reports that they were completing. The other thing that I'd like to share that occurred in the midst of the COVID was we did have a opioid treatment summit, and hopefully you're aware, I believe I've mentioned it here before, is that there are 6 counties that are participating in an opioid Medicaid-assisted treatment with the jails. And we are one of the counties, Jackson. We're a little bit farther behind than some of the other counties. It started a little earlier. They reached out to us when they had some health endowment funds available, and knew that our county was very collaborative with the local community mental health as a part of our mental health services that we put into play as part of the millage. So they reached out to us, and so we have put into play a screening that occurs for everybody coming in as part of booking to be able to identify. They're identifying about 13% of individuals coming in having an opioid addiction, needing treatment. And locally, it is Lieutenant Mike Coburn who leads that, and he is very complimentary of the partnership that both Lifeways and Victory Clinic, who's providing the treatment for individuals that come into the jail. They also report one of the outcomes that they had not anticipated was that people, because they know they can get treatment in the jail, that some people are actually, when they have a warrant, are turning themselves in. And they had not anticipated that as an outcome of this work, but we are excited about it and excited to be a part of that, but wanted to kind of give you an update as to how that is going. The other thing that has occurred as a part of COVID was we did receive some funding from the CARES Act, the Federal Stimulus Coronavirus CARES Act. About $5 million went across all 46 CMHs. It is roughly about $133,000 is what Lifeways received. Those dollars were utilized for the implementation of a lot of the telehealth that had to go into play very quickly. We didn't necessarily have all of the technology to do that immediately, but this allowed us to be able to purchase the technology, as well as the funds are being utilized to support our provider network for stabilization, so we do not have providers that go under as a result of this COVID situation. And those were all approved methods through the department. The other thing that occurred as part of COVID was the state increasing direct care wages by $2 an hour. We did push those dollars out to our provider network and for the direct care workers. There is also legislation that is out there right now, and I'm not sure if it'll pass or not. There's a lot of discussion about, we'll have to go back and make an amendment if it occurs, relative to increasing that to $3 an hour. So we did push out the $2 an hour. It goes through the end of this month. But the bill that's out there actually puts it all the way through the end of September. We'll see what ends up happening with that. The other important thing that occurred was the Governor Whitmer did sign an executive order extending the telehealth, and that's an important thing because you do have individuals, while we are slowly ramping back up and people are coming back in face-to-face, some people are quite nervous about doing that, and the ability for us to continue some of the telehealth as we slowly move through that tier is really critical. So that was good to see that had occurred. Next month, I do plan to give 2 updates relative to the current status of the building, as well as where we are with the millage funding and the use of those dollars for this year. Because it'll be the second quarter, so I'll have an update at that time. I will now pass it back to all of you if you have any questions of my report.
Commissioners, any questions?
Yes,
On the assessment score,
yes.
you have an opportunity to improve on it then?
Yes, absolutely.
Okay.
Oh, yeah. We have the plan of correction already written, and part of that is bringing down the department to work with our recipient rights advisory committee around the appeals, because that's really where we lost the majority of our points.
Okay.
Yeah.
All right, any other questions? All right, seeing or hearing none, thank you very
All
much.
right. You all have a good day. Thank you.
You too. All right, next item on the agenda is Region 2 area aging.
Good afternoon. Can you hear me?
Yes, we can.
Okay, great. Hi, I'm Julie Weatherby, CEO at Region 2 Area Agency on Aging, and I just wanted to present my report today. And you all should have a copy of the report. It was sent out last week, but just a reminder, the report represents funding for fiscal year 20 through April 30th of 2020. And all the numbers are there. We contract with Jackson County awards go to Jackson Department on Aging, Legal Services of South Central Michigan, and Catholic Charities of Hillsdale, Jackson, and Runaway counties. And you'll notice our Medicare Medicaid assistance funding is on the report too towards the end. And that funding has a different calendar year for reporting, or year for reporting, and that is from April 1st through March 31st of 2020. So we're just starting a new year for the MAP funding. But so far in Jackson County, client contacts were over 1,300 for the Medicare Medicaid assistance program, and the dollars saved to clients was $940,000, just over that $940,000. So that's one of our important programs. It's not funded fully, but it is very well received by those we serve, and there's a whole team of volunteers here at the Area Agency on Aging, as well as Jackson Department on Aging, that help with that program. You'll also notice in the funding under the in-home services or home-delivered meals, that it does show Families First Coronavirus Response Act nutrition service allocation, which was an additional just over $42,000 that went to Jackson Department on Aging to provide additional nutrition services to support the increased demand during the coronavirus time. As far as our advocacy goes, we continue to work with our association partners and fellow aging providers to advocate on behalf of the needs of older adults and adults with disabilities to our state and federal legislatures. Of course, as we all know, we all have significant concern regarding the fiscal year 21 state budget. As estimates, the last I noticed was a shortfall of over $3.2 billion. So we are all watching that closely and how it will impact the services we're able to provide and the funds we'll be able to give out to our contractors. And we continue to share stories with our lawmakers about older adults and adults with disabilities and their caregivers in our service area and the importance of the funding that we receive. It's time again for our annual implementation plan update. Aging and Adult Services Agency is going to the State Commission on Services to the Aging to extend our current year, fiscal year 2020, area implementation plan through fiscal year 2021. to the coronavirus, and they look to extend that plan. But we are working within the plan, and we have a public hearing set for by Zoom on June 16th at 10 a.m. We've already shared that invitation with you all, and encourage and invite you to join our hearing to inform needs for services and programming in our area. And just as a reminder, we serve Jackson, Hillsdale, and Lenawee counties. As far as the coronavirus, and an update regarding that and how it's affected the Area Agency on Aging, of course, just like many of our fellow nonprofits, it's been a whirlwind, but our team here is strong, and we've risen to the challenge. Immediately after the state declaration, we did transition to most of our staff working remotely, and have an emergency response team internally that's looking at the needs of our staff as well as the individuals in our service area. And this group here at the Area Agency on Aging continues to meet twice a week to sort through the different state, federal, and local guidances, as well as, the executive orders, and to make sure that we are compliant and that we are doing the best we can for our providers, our participants, and our staff. We have, even though we're closed to visitors, we have remained open to older adults and adults with disabilities through the pandemic. While most of our staff are working remotely, folks calling into our agency would never know that. The phones are answered by a person, and we are working around making sure that we're meeting the needs of those that call. And then communication continues to be a focal point. We've been together with our providers, our community partners to address needs and fill gaps as they become apparent. We are calling all of our participants weekly to make sure that everything is going as planned, and reviewing their service plans and making sure, what their new needs are. We had in our area plan last year a Friendly Reassurance Program, which is a plan designed for older adults to receive weekly phone calls to provide companionship and reduce social isolation. With the pandemic coming forward, we saw the need that we needed to implement that sooner, so that's happened, and we continue to have a lot of interest in that program. We're also working with unmet needs, and we've been part of the JCAN and working with other community partners to find resources, and have helped with food insecurity, prescription pickup, grocery shopping, transportation, and personal care needs. And also we've found the need to increase our help for caregivers and supports. Many of our caregivers have, had to pull double duty in this time because our older adults are nervous about getting out and leaving their homes, so they've been called into duty to help. And so we've been doing things like looking at rolling out some tutorials to help older adults learn how to use technology such as we are using today, like Zoom, so that they can communicate with loved ones as well as their doctors to make sure their needs are being met. We're also exploring a platform for providing care to older adults in their home, some online training for the caregivers. We really appreciate the strong partnership we have with Jackson County Department on Aging, and together we've been able to support, Jackson County residents during this crisis. On March 23rd, Jackson Department on Aging suspended in-home services while continuing to deliver thousands of meals and provide counseling and information and referral services. And during this time, we helped to collaborate with JDOA to offer temporary in-home services, which is personal care, homemaking, and respite, with alternate providers. And we look forward as Jackson Department on Aging returns many of their staff to transitioning those participants back to JDOA for in-home care. We are currently working with our providers, including several of Jackson County-based agencies, to help with personal protection equipment, and we continue to seek donations, which we use to support our providers and participants. We have received some donations of personal protection equipment from Aging Adult Services Agency, and we get that out to our partners in the 3 counties to share that. With the grant, millage, and labor dollars, Jackson Department on Aging is currently delivering over 7,500 meals per week, with plans to begin offering curbside pickup in the next few weeks. Since the pandemic started, there's been more than 100 new clients that need home-delivered meals, and we're so thankful to be able to work with Jackson Department on Aging to make sure that those meals are delivered. Also, we've been able to, with our Aging and Adult Services Agency at the state level, we've been able to offer quarantine boxes to 175 Jackson County residents, including we received a new delivery just last week, and we've gotten those out to the Jackson Department on Aging to help with a lot of the delivery and organizing for the pickup of those boxes. They were also gracious enough to be a drop-off site for all the quarantine boxes for the 3 counties, and then the other Hillsdale and Lenawee County folks went there and picked them up. Also, through Aging and Adult Services Agency, we were able to get some fresh produce boxes, which come with a variety of locally sourced seasonal fruits and vegetables, and those were able to be delivered to 60 individuals in Jackson County. And that is also working with Jackson Department on Aging's weekly delivery system, and we're slated to get those fresh vegetable and produce boxes through September 30th, and there's a possibility that will be extended even farther. I know Mary Beth just talked about the direct care worker wage increase. We also have been working on that to get that out to our providers, and it's a $2 per hour wage increase for the direct career workers directly, and for us through our My Choice Labor Program, there was also a 24-cent addition to that hourly rate to get to the providers to help cover their costs with providing that wage increase. And we are keeping track, too, of that statewide effort to go to the $3 per hour for the direct care workers, and watching that closely, because if that does go through, then we're going to have to make some adjustments as well. And finally, I just want to say one more thing. Our Safe Haven event, which normally we hold in person, but this year it's going to be held by Zoom. It's a fundraising event for Safe Haven, which is a program that helps victims of elder abuse in our 3 counties, and that's going to be held on June 17th at 4 p.m., and you register on our website, and I invite you all to attend and or donate. And then finally, I just want to say how much we appreciate Marcy Wendell's many years of service, and the opportunity to collaborate with her at the Jackson Department on Aging has really helped many older adults in Jackson County. And at the same time, we're so thankful to have Danielle Paquette stepping up and being in that new role. We've already had several meetings with her, and I'm working with her closely to do whatever we can to help the transition be as smooth as possible. Any questions for me today?
Commissioners, any questions? Seeing or hearing no questions, thank you very much. We appreciate the information.
Okay, thank you.
Thank you. Have a good day.
You too.
Good afternoon. And Julie covered like parts of my report, so that was, I'm very thankful for that. But again, good afternoon. I just wanted to go over some of the things that I put into the report and add a little bit more details. Julie had mentioned the produce boxes. So far, that's worked out very well for the seniors that we've been need that extra nutritional support. It ends up being about a 15-pound box that comes in. So it tends to have, and of course you see the picture there, it's got like apples, they might throw in oranges. I think we're very thankful in Jackson. I was on a director's call last week, and in other areas of the state, they've been having issues with their produce boxes, maybe not getting the quantity that they expect, or maybe the product in them is not the standard that you would want to have it at if you were to take those out. We have not had those issues. We had one issue with the boxes themselves. Because of the weight of the boxes, one delivery came and they didn't tape any portion of the box. It was very weak when you went to go and hand it to somebody. So we kind of like double bagged those and let the purveyor know, and they made the corrections to those. So when they came last week, that was a whole different box than they had before, and it was much easier to transport for our drivers and our staff who help to deliver those out to the seniors. We coordinate with a volunteer if we're able to get those out. Like on a Wednesday, she comes in and she'll take 10 of those and hand them out to seniors in the community. The biggest thing with the produce boxes is that the senior cannot pick them up themselves. They can always send a proxy to do that, or we'll get them out through like staff who live on different areas of the county. I'll take a produce box, depending on the area of county that I live, and make sure that they get out to the people that need them. So far, it's been working out very well. Let me look here. And of course, Julie had mentioned that we received another shipment of what we call Q boxes, which are like a shelf-stable box that has, on average, about enough for 22 meals. So it is quite heavy. It's about 26 pounds. It's definitely something, if they have a proxy, we help load that for them. If they need to be delivered to a senior's, we'll walk it up the stairs wherever it needs to go, because it is a lot of weight. People that have concerns about us entering into their home, we just suggest if we can set it inside, and then they can open up the box and then kind of break it down and move things slowly, because they are quite heavy. But again, very useful. People have been very happy with that extra opportunity for good nutrition in the home. As Julie had mentioned, of course, our Meals on Wheels, those numbers really went up as people weren't able to get out to the stores, couldn't find things in the store, just a lot of apprehension about that. And so our counts went up a lot for the home delivered meals. And in something that Julie had mentioned, doing like a pickup. That's for people that we took on additional people during the times that were not considered to be like a homebound person, and we put them onto the meal routes, which increased the size. We're switching to look at the people that are not homebound to have them do a pickup. Either they can send a family member if they're hesitant, or they can pick them up themselves. If people have like a drive-through, we'll have a like a specific time where they would be able to come in, and we can take them out to their car, or however it works best for that person. So we're kind of, as an aging leadership, looking at that later this week and trying to figure out the best way to make that transition, which that'll help our meal routes that are so large, and decrease the delivery time. And of course, some of those people that originally signed on they're getting out and about, so we need to transition them to something that's more appropriate. Down further, it talks about the additional funds that we receive from Families First. And my number looks a little bit different than Julie's that she had said on the screen. I went based off our statement of contract award, so I feel pretty comfortable with the number that I reported there. We're also receiving some additional Families First dollars. We don't have this current statement of contract award, but it'll probably be between $120,000 and $133,000. I can report more specific on that as we progress, but those dollars don't have to be spent till 2021, so we don't know the exact date for that, if it'll fall on the September date. I've heard a June date, so we'll have to wait and see, but again, to help support the meals program. And something that we did with the congregate service, because we don't have our senior sites opened, is we combined the home-delivered meal amount, and we're able to transfer in the congregate amount, so it'll all go to home-delivered meals. That has seen the biggest increase, and again, where the costs have really gone up. So we thank the flexibility of the Region 2 Agency on Aging for allowing us to move the dollars, not just in the nutrition programs, but we spent time last week looking at all of our programs. So if we're underspent, maybe like in senior centers, because we haven't had them open, but we're able to move those dollars as long as they still have the same funding source. So we're currently going through that process right now, so that make sure that we're maximizing spending our grant award this year. With in-home services, last week was the first week that we went in and provided some homemaking services for our older adults. Currently, the workers are going out and seeing one client per day, but they're spending a lot more time with the seniors. Usually, it's like 2.5 hours every other week, but we haven't been in the field to see them. And so when the workers are going, it might be a 4 or 5 hour visit. What we were hearing feedback from our workers and from the seniors is that just having their laundry done, people would have like 6 loads. That it's very difficult for people that might have physical limitations to get things out of the washer, get them into the dryer, things like that. So just getting out there and connecting again with the older adults, seeing what their needs are that they can report back, because they're seeing that face-to-face. That face-to-face is just so important, getting out into the home and seeing what the needs are and what's actually going on. So we're very thankful to, again, go back out in the community with that service. We'll start looking at personal care, which is help with showering, once we have the proper PPE. Currently, the issue's been gowns. We have a lot of other PPE, we just cannot get the gowns. So we're working through that right now. And I think with the moments of excellence, I just added that on there just so you can see some of the notes that we've been getting. Again, I think just hearing from the people that actually receive the services, we hear a lot from our staff, but the people that really benefit from the programs, I think are most impactful. So I just kind of added a couple notes. We get a lot of notes when people might send in a donation or a letter comes in, and again, just thankful that we can be there in the community. Do you guys have any questions? Yes.
Commissioners, any question? Commissioner Williams?
Good afternoon, how are you?
Good.
Good. I just had one question. With the Meals on Wheels program, with the pandemic, did you see an increase in meals delivered?
Yes, we probably jumped up over 100 people, so it went up quite a bit. So we really had to change production. That's another reason we had to look at going to more like a frozen style versus a hot, because the quantity of meals that we have to put out, because it's not just that Monday through Friday, you're covering the weekends, that it really went up.
Okay.
And so the cost for that program went up a lot.
Sure. Do you by chance have the breakdown as to where, or what parts of the county are these meals going to?
It's something that I could give you, because we do have the demographic information in our system. I don't have that broke down right now, but I can.
Okay, that would be great.
Mm-hmm, yeah.
Thank you. And there's no rush on that.
Okay.
I have nothing further, Mr. Chair. Thank you.
All right, thank you. Any other questions, commissioners? I do have one question. I'm just curious along that same lines of that increase. Do you have, right now, it seems like you've received some additional funding to be able to help cover the additional cost. But we all know probably pretty soon that some of that funding is going to start running out. Do you have any concerns about like the future of if that additional 100 people that you guys added need to stay on, and if the need for those additional meals are still there? Do you have any worries about being able to cover that additional cost after the state funding or federal funding that you received?
I think for this year, because we're able to shift the dollars that were in the congregate program into the home delivered meal program, I feel like we should be able to balance out. I also think that we've worked well with our food purveyor. So we've looked at changing different menu options. We've made the menu affordable so that we can make sure that we're getting the meals out there. They've came to us with different ideas too. So again, our cooks are helping to prepare those frozen meals. And so we're always looking at cost and cost savings. We get really excited when we can get something at a reasonable price. But again, it still creates a very healthy meal for the senior. But again, looking at different ways to reduce those costs. We're only delivering 3 days a week, so there's 2 days a week that we're not delivering. Some of those hours are stretched for delivery, but we're also saving a little bit of dollars there, not delivering the 5 days. Our goal is to get back to the 5 days because it does provide that valuable check-in to the seniors, and it's also that nutrition that you look at the hot meal versus the frozen meal, even though it can be the same, it's receiving it as a the cold meal option, things like that. So I think this year we should be okay. Again, we're continually looking at budgets and best ways that we can maximize the dollars that we have. And some of those people will go back to like that congregate, so it'll even out, I feel, this year.
All right, thank you very much. Any other questions, commissioners? All right, seeing or hearing none, thank you very much.
All right, thank you.
All right, have a good day. And next on the agenda is the Health Department. First item is the FEMA letter and health order for reimbursement.
Okay. Good afternoon, all. It's wonderful to see the sunshine out there. The first item that I have is for a FEMA letter. This is essentially something that we're doing to put our ducks in a row. What it is in order to be able to obtain FEMA reimbursement, at least partially for for this particular cost incurred as a result of COVID, we need to submit a pre-approval letter to FEMA that's approved by you as the board. And essentially, we haven't had to open up a shelter of this nature yet. Lucky that we haven't had to. Essentially, what it is for is individuals that may be hospitalized and then released and have no other place to go, such as a home environment. It might be a prisoner that's on parole and released and doesn't have a home environment to go to. So we're just asking that this is, at one time, I believe it was last month, you had signed the America's Best Value Inn agreement. In there, if you recall, we had indicated there would be other costs associated with this in addition to having the beds available, and that includes the food, things like transportation, like getting individuals to the facility, things like that. So this dollar amount is a little over $144,000. We figured it for per month basis on the costs, and again, not knowing how many individuals will have this need, it's just a rough estimate, and knowing that depending on how long or how often people would need that home environment, we may be rotating people as they finish their quarantine or isolation period during that time frame. So the agreement here is that the local unit of government, the county, would would pay for the entire full cost, and then at such time we would obtain up to 75% reimbursement from the federal government. So still the local unit would be covering 25% of the cost. Unfortunately, that is how it's written under the Emergency Powers Act. And I'll stop talking and take questions this time.
Commissioners, what questions do we have? Kennedy?
Yeah. So, hi, Rashmi.
Hi, Commissioner Kennedy.
If we didn't, which I'm honestly don't think we're ever going to need to use this, but if we didn't, there would be no cost associated then, right?
Correct. At this time, we did have the situation over at the homeless shelter where we had to close down the shelter, and fortunately we were able to shelter in place. But if a situation like that arose where we had to, say, release individuals from the shelter, or the shelter was closed down and people had no place to go, this would be a scenario where we might need this.
Okay, so there's no upfront out-of-pocket cost?
The county would be paying, not at this time, but essentially the way the process works is the county does pay up front, and then the FEMA reimburses at 75%.
But that would only be if we needed to do it.
Correct.
Okay.
Correct. Thank you.
I see flailing arms over on the side over here.
Makes that decision, is the person eligible for it?
Sure. So Commissioner Stillwell, the way we do it is, you'll see here that we've issued an emergency order, meaning that it's a public health responsibility during a pandemic, if we have that need, that it's our responsibility to assure that we can monitor these individuals and find them. So that's partly we do it for the reason so that we have the ability to monitor them. And again, it's for health reasons. We're not monitoring, for any other reason.
I understand, but who decides how many people will be eligible?
That would come again from the health department. If we hear from the hospital that they're releasing, say, 10 individuals that have no home or place to go, they would notify us, and then we make that determination to open this type of facility up.
My concern is an unchecked balance. You don't have to come back to us if we put 25 people in, or we put 5,000 in. There's no limit.
Right.
I think we should have some type of check that makes you come back and say that we need more beds.
Well, and that, sure, and I think that's where, too, there'll be individuals that remain there for that period of that 14 days when they're either in isolation or monitoring. So, we hopefully don't foresee somebody being in there for like a month at a time or, extending that. So we would keep you notified of the capacity and the ability to keep that, at a level that it's manageable.
But we monitored somebody for over 70 days. So I am concerned about it. That would be a cost that we would have to find within our budget, again, to make up. All I'm asking for is that we come back and say, yes, you can put 25 people. That's all I'm saying, and we don't have a number there. We can move as many or as less as what's in place. That's all I'm saying. I'm just looking for a check. Some type of responsible check.
Sure, and
And every 25 people, every 50 people, every 161,000 people, you're going to come back and ask us if we can do it.
sure.
And easily we could end up with a situation where we're spending hundreds of thousands of dollars that we don't have at the county.
Yep, and, we'll definitely be monitoring and keeping an eye, just like we do in any of our program areas. That would be monitored separately and checked. And, we can figure out a process in terms of me coming to the board or coming to you as the chairman or Mike or something like that, or, the county administrator. The only thing is I would ask, we try to do that in a timely manner because it's critical that once we identify these individuals, that we do get them housed. Then we start that monitoring process as soon as possible. So I'm happy to chat about a process that we want to, look at, if it were to come down to it, because I understand what you mean, but I think also as the department overseeing this, we would be responsible to, and be remiss if we didn't keep our costs in check, such that they wouldn't be out of control.
Before this, is this going to go to the full board?
It would have to.
Like have a check in place? Thank you, Mr. Chairman. I apologize for
No, thank you for the questions. And are there any other questions, Commissioners? I've got two more questions down here. Let's go Pulaski and then Williams.
So to the chair's observation, would we put something in our letter that says the county cost not to exceed X without further authorization? Would that be acceptable to FEMA then? Is that kind of what you're talking about?
I think, Commissioner, that would be something as an internal process. From FEMA's point of view, they would reimburse only up to 75% no matter what the total cost is, if it even got to that point. I think really that's, if I may, that's really more an internal process that I can work out with county administration. Thanks.
Williams.
That was actually, I had the same question. But I guess my second question was, in the event that this was not passed on to full board, is there a contingency plan?
Well, I guess, we would have to see about utilizing, opening up some sort of shelter or some sort of facility with health department funds, or coming back to the county to ask for that. I think what this essentially gives us is some level of reassurance that we get part of those funds paid back by the federal government, seeing that it is an emergency order. So I guess that's Plan B, being that it's still the public health responsibility to assure that a shelter is provided.
Mike?
That's correct. If, regardless, we're on the hook for the cost. It's a question of whether or not we'll be reimbursed. If we don't file this with them, we will not be reimbursed, not eligible. So that doesn't abdicate from the responsibility of taking care of these folks legally.
All right, any other questions? Mr. Bear?
Rashmi. Not too long ago, the County Board of Commissioners approved a hotel to be utilized, if needed, for housing individuals that needed to be given that type of housing. Is that previous agreement, is that part of what you're talking about here in the housing?
Yes, these are like ancillary supportive services to being housed in that type of facility, like the food, transportation, we would try to have somebody, a medical on site in case a medical issue came up. So that's in relation to that hotel facility. The hotel wouldn't be able to provide those kind of things, so we had to assure those would be provided.
Right, but if it ends up that you need to house individuals, the previously approved facility, is that where you will put them?
Correct, yep. Yes, that is the approved facility, yes.
Okay.
Any other questions? Mr. Elwell?
Daniel, thank you. I'm just curious to what extent, if you were to have to employ this type of agreement or strategy, to what extent do you go before resorting to that to find alternate housing for people, or does HFA do that?
Sure. So for example, the shelter situation that we had, we tried to shelter in place. If that's not a possibility, I know the shelter also has been seeking, again, these are individuals, I should also indicate that they're individuals who might be positive or symptomatic or infectious. So really for the public health purposes. It's not a matter of finding housing for individuals who are not in a situation such as that. So for those who, aren't able to be housed, we have to assure that they have a separate room, likely a separate bathroom ideally, being away from other individuals. So, if this happens in the middle of summer and you got summer vacation going on and the hotel's filled with individuals of families and things like that, we might have to either seek a different option or, alternatively come back to look at that. So I guess our backup plan is that we either try to shelter in place or seek a shelter, either a hotel of some kind in order to house that individual. But again, these are individuals that are symptomatic or positive.
But the first option and best option is always to try and get them to shelter at their own residence if possible.
Correct. Or if it's a shelter situation, like, the interfaith shelter or something like that. Ideally, that's the first option.
Rashmi, correct me if I'm wrong, but I was under the impression that if an individual, a homeless individual, has this or TB or some other disease, we don't have any choice but to pay to house them in a hotel or whatever the case may be, per public health state code.
Correct. Thank you,
On the
Mike.
county's dollar.
Yep. So if you recall with the TB1, thanks for bringing up that example, we had done that, and then we also sought reimbursement from the state, whether it was gift cards or rental assistance for this individual. So again, that is the public health responsibility, and again, mainly to be able to monitor and know where that individual is so that we can keep an eye on the disease.
We've heard horror stories in other municipalities, probably not Michigan, of people being forced or talk of forcing people to stay in places again, if I come down with COVID, test positive, you want me to quarantine, I have a home, and I'm not going to be told I have to go to some shelter, correct?
No, that wouldn't be the case. We wouldn't be compelling individuals. Here too, understand that under the public health code, what we did with the TB, as many of you heard, is we took it to the extent of, ordering someone to stay, whether it was in a hotel or where it was, again, so that we can monitor and assess their situation. We don't want the disease spreading in the community, so we want to be able to know where they are so that we can help them and assess and monitor the situation.
In that case, you can speak of the TB was like court ordered, was it not?
It was. But in this situation, we try first to get the individual to cooperate with us voluntarily, and we try, first and foremost, to try to do it in a non-compulsory way.
Don't you always have to get a court order, though, to restrict them like that?
Well, we have to issue, under this situation, Mike, County Administrator, we do have to issue a public health order because we have to explain why is this necessary? Why can't we just keep them in our shelter or another hotel or their home? So we have to write a public health order in order to be able to indicate why we're in that situation now. We had our legal review it at this time, but when we do issue an order, say John Smith has to be ordered, yes, that does come from our judge.
Commissioners, any other questions? All right, hearing or seeing none, we'll be looking for, we were looking for a motion to forward this to the full board.
So move.
It's been moved and supported. All in favor say aye.
Aye.
All opposed the same. All right, thank you very much, Rashmi.
Welcome. Did you want me to move into my monthly report? Okay. Maybe after a change of pace, I'll start off with something other than COVID. Kind of COVID related, but we're very proud of our Women, Infants, and Children program. Basically since the start of the event or shortly afterwards, we got the okay from the state to be able to do remote services for WIC. Understanding that this is a clientele that is in need, still continues to need their benefits, more so because they can't possibly go to the grocery store or be able to get their baby formula, things like that. So it's an essential service. So we're proud to say we usually get an allotment for a certain number of individuals that we're required to serve per the state, and that is 4,277. But over these last 3 months, you can see we have either met close to it or exceeded that service caseload, which is great to hear because that's that many more individuals that are being served. For example, in the month of May, we had about 4,500 plus individuals receiving services, so that's great to see. Total client participation increased by 300 plus, just as an example for 1 month. And you'll see as a trend there what happened during March and April. So those services will continue on a remote basis, being that we get state dollars for them. We've been told until June 30th we can continue that. So essentially if people can't get their card electronically or in the mail or any way avenue like that, we also offer a drive-up service where staff's coming up, utilizing the full PPE, getting up to the window, helping the client that way. So we're very proud of that. I'll move into the environmental health services. As you recall, the construction had picked up, or at least we got the okay from the governor's office for construction to continue again, which is great news. A lot of our fees are tied to that, so we have been able to start that service, mainly remotely, but also being available at the office if individuals walk in. Under food service licensing, we were doing that also during COVID. We sent out about 458 potential licensees. We included a letter talking about the fee relief options that all of you had graciously been able to help us develop, and that was approved by you. And we extended the due date to August 31st with an additional option to make installment payments with no penalty until December 31st, understanding that a lot of food service establishments may be experiencing a hardship, and as of today, get to finally start opening up, at least at the 50% capacity. So that's great to see. We'll do additional educational-based inspections, of restaurants have continued during the Stay Home, Stay Safe executive order when that was in effect. All staff had been maintaining social distancing again, wearing PPEs and masks when working interpersonally with the managers or the owners of these establishments. We also responded to complaints as usual. Campgrounds is another question that it's at this time when this report was issued, I do have in there that it continues to be closed. However, they are open. Some of them open prior to Memorial Day weekend. And some of them continue to start being open at this time. We also have, consulted with our Parks Department has consulted with us to understand that social distancing should also be maintained, trying to remove areas where individuals might congregate, like, large numbers of picnic tables, pavilions. If you can close them off or somehow, try not to encourage that, that would be ideal. Again, hoping to encourage people to stay within the same household and continue some of those activities, because the outdoor activities are important. So a work group was also recently formed at the state, and as you know, the speed at which things move at the state level is not exactly fast. So we're still waiting for some guidance there from what's coming out of that work group as it relates to some of these campgrounds and some of these regulatory agencies, things like that. So. Next, I'll move on to Zika. This is, in fact, I should say it's more broadly mosquito surveillance. This was done last summer, also as a result of the Eastern equine encephalitis. So we continue to do tick dragging and put traps all throughout our community, and then trying to understand what type of species of mosquitoes are coming about and what type of activity is occurring there. So we're looking for the two types of specific species here, the Aedes aegypti and the Aedes albopictus, I think. That's how you pronounce those, from the northern habitat of the area of the state. They're non-native typically to the U.S., but they were introduced during the Zika, so that's why we probably call this under the Zika program. And then finally, I'll move to our novel coronavirus. Some of this information is out of date, so I'll provide you with the numbers as we know them as of today. We have in our county 460 positives. Unfortunately, we are off by 5 from what we reported Friday. Unfortunately, this is a function of the state system and the fact that we have prisons. It becomes a little challenging because we end up having either prisoner numbers reported within our own figures or other counties that were reported. So we try to clean up that data as much as possible before we publicly put that out. But we put that disclaimer out that the number does fluctuate. Within that breakdown, we have 241 females, 219 males, and 28 deaths. Our death rate has been steady at this point. Meaning that about a third of those do come from our nursing home facilities. We have 2 individuals that have passed away in the minority populations. So, but our numbers overall have remained either steady or just increased just a few cases, but say 5 or so each day. So we'll continue to clean that data up and ensure that it gets put on there correctly to remove the prisoner population, not in our count anyway, and then also those from other counties. On the statewide level, 58,870 positives, 5,656 deaths. And then the other number I wanted to mention to you about, I know it's come up at a study session, is how many were hospitalized. Looking on the Henry Ford Allegion's health system today, they have only hospitalized about 3 individuals related to COVID. So it's good news that that number is another indicator that we realize to know that our healthcare system continues to have the capacity to serve individuals, even if it's not COVID. So that's also critically important, as well as COVID, if it's needed. So going back to the report, apologize for jumping around, there were a few things I wanted to highlight within there that we also have been keeping a track on. As you know, most of our nurses, the most essential service that we're doing is contact tracing, case investigation, meaning if you're positive, we would contact you, let you know that, and then we would also say, okay, who have you been in contact with over the last 14 days, where have you been, what household members do you have, things of that nature. And then educating them on the isolation procedures, trying to wipe surfaces down, keeping away from family members, visitors, keeping away from populations, huge amounts of populations, things like that. So in that regard, we've contacted over 778 individuals during our contact tracing process, and that's a critically important public health function. Let's see, I mentioned the business toolkit. I think that's been out there as a resource, so it's been a good resource. We've gotten pretty good feedback about it. We've tried to make it as clear as possible for the layman to understand, having businesses being able to utilize it, Manufacturing Association, Chamber of Commerce, Enterprise Group, groups such as that. Also help to, at the county level, help to design a process for screening, if they choose to, screen visitors coming into their building, the county building, and also self-monitoring so that we can make sure that our employees are also staying safe coming into work, which is happening next week, actually, at least on a phased-in approach. The other new thing that we're working on, as of Friday, I believe, got notice from the National Guard. We had been encouraging them to help us do some testing within our nursing homes. So we put it out to our nursing homes and asked which ones were interested, and knowing that that's a high-risk vulnerable population. We had about 4 indicate interest. They gave the option of the National Guard coming in to test, or that they drop off the testing kits to do that. We had 2 that accepted to have the kits dropped off, and 2 that accepted to have the National Guard come in. So this is happening tomorrow. If all 4 test their residents and their staff, as the numbers we have gathered, that could be over 1,099 tests overall that come in. So that's a really good percentage of tests that are going to be occurring in our county. That is, again, if everybody who we think has indicated interest actually does get tested. And then we've been working with the Jackson Action Network, as a liaison to assist in meeting those things such as food, shelter we talked about briefly before, other basic needs during this crisis. I believe they've disbanded at this point, but I think they're just still doing some information sharing and things like that. So finally, as we move into this next phase with the reopening next week, we're excited to see that we can partly open some of our services to the public as we've gotten questions about immunizations, things like that. And we, hope to continue to be able to do that, of course, in a safe manner, practicing social distance guidelines, washing hands, reporting illnesses, keeping our employees safe. I think that's it, unless you have questions.
Commissioners, any questions? Mr. Shotwell.
How many people have been covered in Jackson County?
Thank you. I didn't report that, Commissioner Shotwell. 376 that we know of as of Friday. Thanks.
Thank you. Just want to say thank you again for all the work that you do, especially around this COVID mess that's going on, and thank you for helping that family get situated with their license. They called me and said that they got it taken care of, and just want to thank you for giving that some attention.
Sure, thank you. And I hope that, this timeline and we don't have a delay, we can pick services back up to the level that we were at before, and even improved on some level, for some people that have been away from being able to do that work.
All right, thank you. Have a good day.
Thank you, you too.
All right, Commissioners, next item on the agenda is the claims. Be looking for a motion to pay the bills. So moved and supported. All in favor say aye.
Aye.
All opposed the same. All right, thank you very much. We do have one item under other minutes. It's the DHHS board meeting minutes, if you guys want to check those out. Our July reporting schedule is Department on Aging, Health Department, Lifeways, Medical Care Facility, and that brings us down to public comment. Any public comment? Seeing no public and hearing no public, brings us to commissioner comments. Commissioners, any comments? Seeing or hearing none, at this time we will adjourn to the call of the chair.